All right, team. You're now in charge of seeing patients and telling me their symptoms and what you think it could be.
What's your diagnosis?
I think it could be rheumatic fever based on the joint pain and inflammation.
I'm leaning towards ulcerative colitis, considering the gastrointestinal issues present.
Arthritis seems like the most likely culprit to me, given the joint swelling and stiffness.
I believe it could be a combination of ulcerative colitis and arthritis causing these symptoms.
You're all wrong. It's syringomelia. Perform a wedge resection immediately.
But doctor, that surgery is extremely risky. Are you sure it's necessary?
I don't give a damn about the risks. It's the only way to save this patient. Now get to work. All of you.
What if, hypothetically speaking, you did give a damn about the risks?
It would have to deal with my employment, which so far I've had no problem maintaining.
Despite the odds.
Tracy, I need to perform a wedge resection on my patient. I strongly believe they have syringomelia, and this is the best course of action.
As I understand it, you're going to take a wedge out of the patient's spine. Do you know how stupid that is?
I don't think it's stupid,
Why not?
because that'll remove the syringomelia from the spine.
You're going to take a part of the spine with it, based on that procedure.
I doubt it. My doctors know what they're doing.
You have my word on that.
I'm afraid the patient is in critical condition, Gary. They're not responding well to treatment after the wedge resection.
That's unfortunate. I think the wedge resection was not the correct treatment for syringomelia, despite Dr. Hawk's insistence.
I don't think it was the worst idea, but we probably took too much of a wedge out of the spine.
That sounds hard to fix.
That's because we probably gave the spine permanent damage. They'll be lucky to move ever again.
Oh, just perfect. You nearly killed the patient with your misdiagnosis of syringomelia and the wrong wedge resection.
It was probably a simple mistake. We see wedges every day in our salads.
I should have known Gary would have taken a chunk out of the spine by comparing it to a wedge of lettuce until he felt like he took enough spine out.
Spines are a funny thing, Hawks. Like the almighty lettuce, they're the basis of nutritional salad, and everything else is just toppings.
Spines are not like lettuce, Assclown.
Hawks, cool it. It was my fault. Gary gave me the measurements, and I accidentally used the utterly stupid United States customary units instead of metric.
You trusted Gary with the measurements. That's your biggest mistake.
So, what do you suggest, Hawks?
We're here to learn and improve, Dr. Hawks.
You're all a bunch of morons. The correct diagnosis is a spinal cord tumor, you idiots. Now fix your mess and don't screw it up again.
Well, the good news is we probably took the tumor out too.
You guys broke a man. There's not really any good news associated with that.
So, how are things going in the oncology department, Johnson?
Pretty good, actually. We had some really positive outcomes with a few of my patients this week.
That's great to hear. I've been caught up with this one patient who just doesn't seem to fit any diagnosis I've considered so far.
Oh, that sounds frustrating. By the way, have you tried out the packaged Cobb salad yet? It's not bad.
Sorry, Johnson. I just don't think there's a way I can ever think of salad and not break down crying after my doctors botched a wedge resection on the spine.
Wedge resections are usually for tissue, Hawks. Are you telling me you guys ruin a patient's spine?
Wait a minute. I think I know what's wrong with my patient. I need to go check on something. Sorry, Johnson, gotta run.
Isn't the spinal cord being destroyed wrong with your patient? Damn, now I don't feel like eating salad ever again.
Sorry for barging in, but we have a pressing issue at hand.
You can't just come in here without proper gear, Hawks. What are you thinking?
Yeah, it's completely reckless and against protocol.
Listen, I know it may seem irresponsible, but trust me, syringomelia was a misdiagnosis.
What? How can you be so sure? What are you talking about?
I had lunch with Dr. Johnson and we discussed the symptoms.
It's clear now. It's acrodaria.
Acrogeria. I've only read about it in textbooks. What's the prognosis?
There isn't a cure for acrogeria, but symptoms can be managed. I would say this isn't a bad outcome for the patient, but the destruction of the spinal cord outweighs that.
So what do we do for the spine?
We can't do anything about that.
But we can pray.
Frank, Gary, I have an important assignment for you. I need you to run a study for me. Pray in one hand and shit in the other. Come back when you have statistics on which of those produces a result first. Well, it was acrogeria, not syringomelia.
Oh, well, at least there's a bit more hope in managing symptoms for acrogeria. Did the wedge resection help with the correct diagnosis?
Not really. We should probably bill that as an elective surgery since it had nothing to do with acrogeria.
I'm not doing that. You followed through with that surgery despite me telling you not to.
Oh, you're right. I forget that I don't run the billing department here.
Exactly. Well, I'm glad things went right at the end of the day.
I am too. Have a good night.
Wait a minute! What is this I hear about the cafeteria running out of salad?
Don't ask me.